First of all, people talk about health disparities, and how would you define it?
Gaps between one population group and another population group in healthcare. I think we focus too much on disease, and there's so many underpinnings of our health. We haven't focused on the whole community, the environment in which people lived. People can't be healthy in substandard housing. There's a link between poor health and substandard education. The services are not there. When poor people and African Americans and people of color make up the majority of those who are poor, the physicians are not there, the hospitals are not there, Medicaid does not pay enough to keep the doors open, and so the services are not there either. We have to improve the environment in which people live, and our government has to look at health in every policy and every program, I think, that they promulgate or they issue or they come up with. We would like to see the president have an executive order to each of his agencies that they not only do health impact assessments on what policies, programs, initiatives that they're going to come out with, but that they actually add a health component. So transportation is one. If people can't walk to school or to work, if the way the neighborhood is laid out is not conducive to good exercise, they're not going to exercise. When you look at the criminal justice system, there are people who just can't exercise, go out and walk because the neighborhoods are not safe. In the Department of Agriculture, they need to be paying special attention to those food deserts in our communities. So EPA is an obvious one, because if the air that you're breathing and the water that you're drinking is not clean, it's not going to support good health. So there's an issue in every agency, and we've focused too much on, we've spent a lot of money on diabetes, on heart disease, on HIV and AIDS, but we're still dying in numbers that could be prevented from all of those diseases and more. And African Americans have the highest burden of all of those diseases, and deaths from those diseases, and disability from those diseases. So we've spent a lot of time and effort on those, but you can't be healthy in an unhealthy environment. I think for people of color and people who are poor and people in the rural area, we talk about a lot about lifestyle changes and personal responsibility, and we don't realize how difficult it is for those people to take that personal responsibility, because the system is just not set up to help them. Either the services are not there, or when the services are there, as has been shown in several reports, and a person presents themselves to a physician or a healthcare provider or somewhere in the system, they may not get the same kind of care that another person of their white counterpart would get. It's not just a people of color issue. Many times, of course, as African Americans and as African Americans in Congress, part of the Congressional Black Caucus, of course, we talk a lot about health disparities in people of color. But health disparities exist. People in rural areas, people in territories like the ones that I represent. And so it really is not strictly a color issue, although race is an augmenting factor, but it's not just a people of color issue. The other thing is that if I'm not as healthy as I could be, it does affect you. It affects everyone. Third, that eliminating health disparities saves healthcare dollars. Again, this time it was the Joint Center that did the study. Over $1 trillion over a 3 or 4 year period could be saved if we eliminated health disparities.